Scientists in South Africa are pursuing a long-term goal that could transform HIV prevention. A safe, affordable vaccine given in the first year of life with no need for repeat doses. The launch of the country's first ever human HIV vaccine trial, known as Brilliant 011, marks a major milestone in the global effort to end the epidemic. About 20 HIV-negative South Africans are the first participants in the new study. South Africa remains the epicenter of the global HIV epidemic, with an estimated 8.15 million people living with the virus and around 6.3 million currently receiving treatment. The trial is conducted by the South African Medical Research Council, the DTHF, and the WITS Health Consortium, and forms part of the Brilliant Consortium. In 2023, the consortium received $53.48 million in funding from the US to roll out the HIV Vaccine Innovation in Africa program known as HIV Vista. Participants were recruited through extensive community engagement and will remain in the study for a year. The primary focus at this stage is understanding how the vaccine affects the immune system. As part of the study, researchers are collecting large blood samples and using a specialized process to remove white blood cells, allowing them to closely examine immune responses triggered by the vaccine. Last year, a long-acting injectable HIV prevention drug, lenacapavir, received approval in the US. South Africa is among the first countries expected to gain access to the drug. Our correspondent Kalden Ongmu reports from Johannesburg.
Local scientists in South Africa have kicked off a pioneering first-in-human trial to test a new vaccine aimed at giving long-term protection against HIV to newborns at risk. The trial marks a critical early step in HIV vaccine development. According to experts, unlike traditional vaccine studies, Brilliant 011 uses a cocktail approach, administering two vaccine products together to stimulate strong immune responses. South Africa already runs one of the world's largest pre-exposure prophylaxis programs with more than 1.3 million participants. As the world reflects on progress towards ending AIDS, the South African Medical Research Council emphasizes that vaccine research remains one of the most critical frontiers in HIV prevention, alongside existing treatment and prevention strategies. This is Kalden Ongmu from Johannesburg, South Africa for WION World is One.
TikTok, which is under new ownership in the United States, has confirmed that services in the US have been fully restored after a major outage last week that disrupted the app for millions of users. The outage affected TikTok's more than 220 million users in the US, with problems ranging from failed posts and search errors to slow load times and missing view counts. According to TikTok, the disruption was caused by a severe snowstorm that triggered a power failure at a primary US data center operated by Oracle. The power loss led to network and storage failures, impacting tens of thousands of servers that support TikTok's core functions. The company said features including content uploading, video discovery, and real-time metrics were temporarily affected, but systems have since been stabilized and normal operations restored across the platform. The disruption also drove users to rival platforms, with several alternative social apps reporting a sharp rise in downloads during the outage. The outage came just days after the US finalized a new ownership structure for TikTok, under which a US-based investor group now holds an 80% stake.